And welcome to the Dr. Bob Show. We'll be spending most of this show talking about shingles. The older you get, the greater the chances you'll get shingles. And we get older every day. What causes shingles? What are the symptoms of shingles? How do we know if we've got shingles? Is there something we can do for shingles? What is the biggest problem with shingles? And is there a vaccine that treats it, and which one is best? Boy, do we have a lot of questions, and a lot of answers will be given by Dr. Meredith Overholt. Dr. Meredith Overholt is a board-certified dermatologist, and she'll be answering our questions. Hello, I'm Dr. Robert Overholt. We'll be spending most of this show talking about the shingles, but later on we'll be talking about mold problems. Is it allergy or is it something else? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Meredith Overholt, board-certified dermatologist, skin specialist, and we're going to be talking about shingles. Meredith, welcome to the Dr. Bob Show.
Thank you so much.
What is shingles?
Shingles is a rash that's the outward sign of an infection with the varicella zoster virus, which is the virus that causes chickenpox.
So what are the symptoms? If somebody has shingles, what's it like?
Yeah, well, the term zoster actually means band-like, so it's often a rash that occurs in a band-like distribution. So almost always it's going to be on one half of the body only. So there are rare exceptions, but for the most part, if you've got a rash that's only on one side, that could be zoster, that could be shingles. If the rash crosses the midline, it's very unlikely to be shingles.
So it's the entire one side of the body?
No, just in a single area, what's referred to as a dermatome. And a dermatome is the area of skin that is served by a single spinal sensory nerve. Okay, because what happens is when you have chickenpox as a child, the virus never leaves you. It just goes and hibernates, and it hibernates in a type of cell called a dorsal root ganglion. And these are cells that line our spine. And so at some point when our immunity wanes, usually with time, age, there's some other reasons too we can talk about in a second, the virus will come out in the distribution of a nerve. So one side of the body, it can happen anywhere from head to toe, but it's generally in a band-like distribution.
So is it easy to diagnose, and what are the symptoms and how do you diagnose it?
Well, certainly a classic case is easy to diagnose, and certainly once it's already blistered, it's pretty easy to diagnose. But there are certainly stories I remember from the ER when I was in training where a patient would come in with an acute abdomen, terrible abdominal pain, and this was prior to CAT scans, and they would take them to the OR thinking they had an appendicitis, and nothing's wrong with the appendix. They sew them up, and a day later, there's the rash.
Oh, that must be terrifying.
Can absolutely happen.
So do symptoms come before the rash, or does the rash come before symptoms?
Usually the symptoms begin before the rash. It may be fairly concurrent, but you can have some little viral symptoms. People will feel a little under the weather, maybe a little febrile, maybe a little chilly, and then the rash will begin. Oftentimes, at first, it will just look red, and maybe the skin will feel tender, and then later the rash will actually break out with the full-blown blisters.
So you can have symptoms without the blistering rash that comes before.
Right.
How many days before you? That's scary for somebody that's having a dermatome pain.
Right, right. And fairly quickly, just within 2 or 3 days, they ought to begin to develop the visible symptoms of the rash.
When the rash comes out, what does the rash look like, the little blistering rash?
Yes, it's usually red patches. We call it urticarial, which means more like hives, and then the blisters will be on the top of that. Okay, and it's important if you do recognize those to get to a doctor as quickly as possible.
What does that
Time
mean?
is of the essence.
Sometimes it takes, you know, a little while to get to see a doctor. What does it mean, get as quickly as you
I
can?
would say this is one of those cases where you call every doctor you know and get in as quickly as possible, whether it's your dermatologist or your primary care doctor or even one of the little walk-in clinics. You know, if you can't get in quickly with somebody else, go and see, because the faster you get on medication, the better chance you'll shorten the course of the illness substantially if you do it. If you get the medication on board within the first 3 days, first 72 hours of having the rash.
So, what medication do you take?
Well, the acyclovir, or its newer cousin valacyclovir, Valtrex was the brand name of that, and
So Valtrex.
those are the medications generally given for shingles.
Why do you give Valtrex? Why do you need to do it immediately? Why can't you wait 5 or 10 days, make sure what it is, and just see if it goes away on its own? Why do you want quick treatment?
Well, the virus replicates in the first 3 days, so the rash is on the uptick. And by the time you hit to 3 days, it's pretty much done that, and then it's just that long course down. So you have to stop it on the way up to really make a difference in how well the virus, how quickly you get over the shingles.
So the Valtrex, if you find it early and you use it quickly and you use it early, does it keep you from getting problems later on?
We think somewhat. Those are hard studies to perform, and I think what we're referring to is a condition called postherpetic neuralgia.
Postherpetic neuralgia. That means after herpes
Right.
pain.
About a third of people over 50 will get shingles if they do not take the vaccine, which we'll talk about in a bit. And of those people who do develop the rash, 20% of them will go on to have pain after the rash is over. So it's normal to continue to have symptoms of discomfort in the area where one's had shingles for up to a month, 4 to 6 weeks after the blisters have dried up and fairly well healed. But in about 20% of people, they can continue to have pain in the area where they had shingles, and it can really be a problem.
Somebody told me that the after shingles pain, the postherpetic neuralgia, if you get that, it's like you want to go to the bridge and jump off because the pain is severe.
Well, it varies, but it certainly can be very uncomfortable. There are treatments for it, but it's absolutely one of those things that is much better prevented than treated.
So the Valtrex will help decrease the incidence of after
Postherpetic
shingles
neuralgia
pain
by somewhat.
by somewhat. It doesn't guarantee it, but
Right.
take it. It's worthwhile taking it so that you don't taking the Valtrex,
Correct.
so that you won't get the postherpetic neuralgia.
Correct.
So if you've taken Valtrex and you do get postherpetic neuralgia, what can you do something for that?
Sure. You know, there are simple things like lidocaine creams and lidocaine patches.
So
that
that
can
would be
used.
a local anesthetic.
Yes.
Lidocaine, they got a patch for it?
They do have a patch.
You can
that
put
can
it on,
go
takes
onto
the pain
skin.
away?
Absolutely, very helpful, because remember that shingles is an infection of the nerve, and so that's why it can be so painful. And when it damages the nerve, that's why we have that persistent pain. So things that help calm nerve pain are what are helpful. So certainly things like lidocaine. And then probably the thing that is used the most is gabapentin, or which used to be Neurontin, or its newer strength cousin Lyrica. Those are medications that are specifically for neurologic pain, and that's what we usually see used in postherpetic neuralgia.
Biggest question I hear is shingles contagious? If you've got that blistering rash, is it contagious, and who to?
Right. Generally not, and certainly if somebody has it on their skin and it's underneath their clothing, it's hard to give it to somebody else. And you won't give somebody else shingles, but you could give someone who's never had chickenpox.
Oh my goodness.
And so you do have to worry about being around small children if they've not been vaccinated, being around pregnant patients, infants, people who are known to be immune compromised. Maybe you're visiting somebody in the hospital who's undergoing chemotherapy. You should not do that if you have an active case of shingles.
Wow, so you do have to be careful.
You do.
It is contagious, but if somebody
On a
doesn't have
limited
the
basis,
immunity.
yes.
So in general, I've had chicken pox. I've got immunity to it, even though I've gotten older. I've checked it. I've got my immunity. So I could touch somebody and probably wouldn't get it.
Right.
Is there a vaccination? Can we prevent shingles from occurring?
Yes, we can.
And that's what we're going to be talking about when we come back. We can prevent this disease. Everybody's afraid of getting shingles. There is a vaccination available. Can you get it? Is it effective? What does it do? What are the side effects of it? What if you're allergic to it? Is there a chance you're allergic to? You're going to learn more information than I think is possible. Stay tuned. We're talking with Dr. Meredith Overholt, board certified dermatologist, one who specializes in skin diseases. We've been talking about shingles, a blistering red rash that follows a pattern from nerve endings in the spinal cord. The rash is very painful. It's blistery. We've talked about after shingles. You can get after shingles pain called post-herpetic neuralgia. So we want to get on a medicine called Valtrex as soon as we know that you've got shingles. Immediately get on Valtrex by your primary care physician or anybody that you can get, like a dermatologist or your primary care. Now we're going to continue talking about shingles and is there a vaccination? But before we do that, who's at risk for getting shingles?
Well, you have to have had varicella or chicken pox, but frankly, most people have. There is a vaccine, but those people are only 30 years of age, so about that started having that. So most people, over 50 is the general time frame when shingles really increases, although there are certainly cases earlier. But people who are immunocompromised, maybe they have cancer, undergoing cancer treatment, maybe they're on a medication that suppresses their immune system. You certainly see advertisement for those drugs all the time for rheumatoid arthritis or psoriatic arthritis or Crohn's disease. Those medications can suppress your immune system in such a way that shingles is at increased risk. People who have HIV or other diseases that suppress their immune system are under a lot of stress. That's where I see a lot of cases of shingles or people who are under a lot of stress.
But the increased incidence is after age 50. Can you get it at age 40 and 30 and 20?
Absolutely.
Yeah, and so everybody has to pay attention to the symptoms of shingles. What is the danger of shingles? I forgot to ask this earlier. If it gets on the face, or what else makes it dangerous?
Right. Well, we talked about the post-herpetic pain, but if people get the shingles rash on the face, particularly in this upper facial area, it can affect the eyes and it'll cause a corneal infection, which can actually damage the eyes and cause blindness. It would be one-sided, but still bad.
What does it look like if it invades the eye? Does the blistering rash get to the...
Absolutely. It can come in this upper facial area, and one of the classic signs is a blister on the tip of the nose. That means the ciliary nerve is infected, and when I see any shingles case that's in this area, I call up my friends in ophthalmology and ask to send them over immediately, and they always take them right then so that they can check on that.
And there are medicines that they can put in the eye to prevent that if we catch it early.
Catch it early. And then there's what's called the Ramsay-Hunt syndrome, and that's where the shingles actually ends up involving the ear and the acoustic nerve, and then we have
that's the hearing nerve.
Yes, potentially hearing loss, potentially dizziness, and tremendous problems from Ramsay-Hunt. So again, another reason to go ahead and get the vaccine instead of
does the ear begin to sting or hurt or throb?
Absolutely, and you do get the rash around the ear, so you have that outward sign, but boy, it can actually have all these other symptoms too and be, believe me, much better to avoid than to treat. So
stitching time saves 9. Get to the doctor quickly if you've got shingles that are even thinking about shingles of the eyes or the head and ears. Is there a vaccination? We've said there is. tell me about vaccines to shingles.
Yes. Well, there was a previous vaccine, Zostavax, that's been around for a while, and it was an okay vaccine. Did reduce the incidence somewhat and reduced post-herpetic neuralgia somewhat. I see many cases of shingles on that, and perhaps they were a little lighter than they would have been.
The new one is called?
The new one is so much better. It's called Shingrix. Okay. And it's
Shingrix. Shingrix.
Shingrix. Okay. And it's much, much better. It is a 2-vaccine series, so you do have to have the first vaccine, and then the second one you take 2 months later, but not as long as 6 months later. So you do have to get that second vaccine in to make it fully effective. But if you do, there's a 90% chance that you will not get shingles. So that's substantially greater than with the previous vaccine, and a marked decrease in the chances of getting post-herpetic neuralgia if you do actually manage to get a case of shingles after being vaccinated.
So it's everybody when they get old, 65 or something like?
You know, it's such an effective vaccine, and the thought is that the immunity to it is so good that the CDC has actually backed up the recommendation to age 50.
Age 50?
So I've already had it.
So everybody 50 or older should get Shingrix, except, are there some contraindications?
Well, there's not very many pregnant patients after 50, but certainly a listed contraindication is pregnancy or nursing. So before that, and then the other thing is allergy to any of the components of the vaccine. But fortunately, this is a vaccine that's probably going to have a pretty low rate of allergy, and that's because it's a recombinant vaccine.
So recombinant, what does that mean?
Well, it's not a live virus.
So it's not grown in an egg culture or in a culture or anything like that.
And you would have people who were allergic to eggs who couldn't take the live viruses grown in egg cultures. So in the recombinant vaccine, what the vaccine makers have done is they've taken proteins from the wall or capsid of the virus that are the ones that cause the greatest degree of immunological reaction. And they found the genes for those and produced those proteins completely separate from the virus.
Amazing.
So yeah, so there's absolutely no way you can get shingles from the virus, from the vaccine. So don't even go there. It's not going to happen. It's not a virus. It's just proteins. And the proteins are combined with what's known as an adjuvant. And an adjuvant means a chemical that's basically able to make it more powerful, really ups the immunogenicity of the vaccine, so that you're really
you get an immunogenicity, you get a bigger response.
Absolutely.
Are there side effects to the Shingrix shot?
I can speak from personal experience there. Yeah, my husband and I both had it. He had some arm pain from it. It's an intramuscular injection, so you know, if you're somebody who works with your arms and everything, you might think about doing it on a Friday or a Saturday or something like that, because it can cause some arm pain. And then I had a little tiredness the day after the first one, and the day after the second one, I had some shaking chills, which probably if I had thought about it ahead of time, I could have taken some ibuprofen and it probably would have helped, but it certainly can cause you to have an immunologic reaction to the vaccine, so don't be surprised.
So I was reading on the vaccination, on the Shingrix, and it said about 17% would get sort of a local reaction, and 83% don't. So you were one of the unlucky. If it can happen, it'll happen to me, sort of.
Well, maybe
thing.
I'm really well protected because I reacted. So.
Well, yeah, but it wasn't an allergic reaction.
No.
And it just causes that local. So you had a little systemic, but that wasn't an allergic reaction. Didn't cause any shingles.
That's
there was
right.
no problems with that at all.
Right. It was just stimulating my immune system. My immune system was simply responding.
Does it make you feel like, wow, I don't have to worry about shingles again?
Absolutely. I'm so glad, because I see miserable folks, and my own mother had shingles late in life, and you know, I wasn't there in Dallas where she gets to recognize it when I wanted to, and she did have a little bit of the pain afterwards. So, from personal experience, I can say I'm really glad I've gotten the injection, and both of my brothers have gotten the injection because they remember what that was like to watch our mom. So I would really, really recommend it.
Everybody after age 6, everybody after age 50.
Right.
So tell me about, where can you get it? From your doctor, drugstore, or what?
Absolutely. And it's, I think you can tell it's such a popular vaccine and so highly recommended that it's a little hard to find. Okay, so certainly before you go, it's absolutely available. It's been FDA approved for quite some time. It's been available, I think, for probably about 4 to 6 months now. So I certainly would call before you go to make sure that it's in stock. But yeah, I got mine done at a drugstore. But certainly for many people's primary care doctors will also carry it in their office. So you just need to call and make sure that they've got it and that they've got it on hand before you go.
And when you get it, you got to get a second one.
That's right.
2 months later, up to 6 months later.
You got it. Mm-hmm.
Meredith Overholt, you're a great teacher. I've learned so much just listening to you talk about shingles, the dangers of shingles, the vaccination Shingrix, which is available and will protect everybody over age 50. I think those are some of the, and it's recombinant. That means it's not grown in an egg virus. You don't have to worry about
Right. If your immune system is compromised, you don't have to worry about catching the virus from the vaccine. So it's not possible.
Meredith, thank you for coming to the Dr. Bob Show.
Thanks.
I hope you've learned as much as I have. Now you're going to want to stay tuned. We're going to be talking about mold problems. Is it just allergy? Can it cause nose allergies, lung allergies? Or are there mold toxins that can make you feel crummy even though you don't have allergies to it? It's a big question. You'll want to stay tuned. I want to thank Dr. Meredith Overholt. A wonderful discussion on shingles and what you'd better do about it. Now, questions from you, the viewer, that I think will be important to your health. Question number 1, Dr. Bob. Can mold make you sick? That's a great question because there's inside mold and there's outside mold. The outside mold, the mold spores float around the air and they're very, very small. Mold is an organism that produces spores, and the spores are what float around in the air. And they're so small that they can get up into the top parts of the nose, or we can breathe them down to the lungs where they can produce allergy symptoms. And the allergy symptoms of mold allergy is frequently stuffy nose, sniffles, congestion, drainage, blocked head, fatigue, tired, don't feel good. Wake up in the morning and your nose is all stuffy and you have to blow your nose and you know you've got allergies and you wonder if it's mold or if it's dust. That's the outside mold. The inside mold you can have in the house in potted plants and damp, musty places, closed-in closets, a house with poor ventilation, like we had back in the 70s, perfect culture area for mold to grow. Now the inside mold is an organism that forms spores that pop off into the room in the air, and we can breathe those inside the house and we can get the same allergy. The problem is, if you've got a lot of mold in your house, people wonder if mold can make you sick if you don't have allergies. So could you have symptoms from mold exposure in your house or even outside? Yes, you can have symptoms. Sometimes the musty smell makes people get stuffy. Sometimes, in rare cases, there's what we call mycotoxins. Big word. That simply means mold spores can produce toxins that bother people. That was back in the 70s when there was one specific mold called the black mold, Stachybotrys. The molds that most common in the house are Alternaria and Cladosporium. Outside, Alternaria, Cladosporium. There's 40,000 species of mold that can cause problems. Those are the two most common. If you think you've got allergies and it doesn't show up, you can culture the amount of mold in your house. Every room has mold, so it will grow. So you need to compare the count outside and compare the count inside. If you find that the mold count inside is much greater, then you have to look and think, am I having allergy symptoms, or do I not feel good? Do I need to see my doctor? Yes. If you think mold is bothering you, you need to see your personal physician. Most likely, if you're having aches and chills and don't feel good and irritable and losing sleep, those type symptoms, that your doctor will be able to determine whether it's a toxicity or not. That would be very rare. Allergy is very common. 42% of the population is allergic, and mold is a big allergen. That's all the time we have. Remember, we need to be exercising. We need to be exercising 5, 6, 7 times a day and 30 minutes each time we exercise. It reduces stress. It makes your blood pressure get lower. It makes you feel gooder. Feel good, not gooder. And it will make you happier. Eat properly. Eat lots of fruits, vegetables, fiber, less fried, greasy, fatty food. Get 7.5 hours sleep so you'll feel good, so you'll perform well, so that you'll be happy. If you don't get enough sleep, then you get irritable and you get brain fog and you just don't feel good. And the people around you will recognize that you're sleep deprived. Most of all, we like that laughter in your life. Laugh a lot, giggle a lot, make your immune system better. You'll be healthier and you'll stay happy with laughter.